Hey, everybody. Welcome to the video conversation for today. We are Mary Free Bed Rehabilitation, and we are talking some outpatient therapy services. What is PAR? What is pelvic floor and abdominal rehabilitation? And we have one of the experts here at Mary Free Bed. We've got Katy Szetela, who is an outpatient therapist here at Mary Free Bed. You are in the clinic in one of the treatment rooms, taking a break from therapy today, right?
Yes, this is my domain.
And you are a pelvic floor physical therapist. Tell me a little bit about
Yeah.
you and the type of work that you do here at Mary Free Bed.
Yeah, so I've been a physical therapist for almost 10 years now, which is crazy. But yeah, I've been specializing more in the pelvic floor rehab for the last like 4.5 years. So I treat all sorts of different things. I also see patients with our spine and ortho teams, but yeah, I do some of the pelvic floor rehab.
So, what is pelvic floor? Some people call it PAR, pelvic and abdominal rehabilitation, but so many people just say pelvic floor. What is pelvic floor therapy?
Yeah. So I think the best thing to kind of explain first is what a pelvic floor is. So
Yeah.
this is kind of a model of our pelvis, and the pelvic floor is the group of muscles that kind of live at the bottom of our pelvis. So they are helpful in giving support for our abdominal organs and also helpful for keeping us continent and all the things and being able to relax to, go to the bathroom, things like that. So, very important to kind of know what those muscles are and what
Yeah.
we can treat, because physical therapists treat all sorts of muscles, but this group is kind of more individualized and specialized.
Okay. Well, that's so great. I'm so glad you had that and were able to demonstrate that and show that for us today. Who are people that might need this kind of therapy, and what are the problems that they're kind of experiencing?
Yeah, so we see a whole range of symptoms. I mean, this is not an inclusive list. Um, but we see incontinence, we see pelvic pain, abdominal pain. We see patients, after surgeries or after pregnancies or during pregnancies. People with abdominal separation, that's called diastasis recti. We
Mm.
see people with pelvic organ prolapse or overactive bladder or constipation. So there's a lot of different diagnoses that we can treat. And so basically anything going on with bowel or bladder, we can probably treat.
And it's not just women too, right? It's men and it's
Correct.
kids that you guys see and work with, right?
Yep. So I mainly work with women, but I have other colleagues in our program that work with children and men as well.
And how long would someone come and work with you? Like if they're having some kind of issues and they have to start working with a physical therapist, how long might need this?
Sure. So, it really depends on what kind of symptoms they're experiencing and how quickly, you know, we're able to start to make changes. So, it can really range from, 3 to 4 sessions to 3 to 4 months, depending on the situation. But I'd say probably the average is somewhere kind of in between.
And how does the therapy help someone if they're struggling with that pain or one of the other kind of issues? How will working with you in this therapy help them overall?
Yeah. I think it just helps, yeah, patients either get relief or helps them with being more confident or free. So a lot of the symptoms that we end up seeing, are embarrassing, and people don't often know that a patient might be struggling with these symptoms, or, it's not something you can see. So that makes it hard and kind of isolating for the patient. And I think that can also lead to some frustration because they feel so, alone with it. And so it is very helpful to be able to identify maybe what's contributing to those symptoms and be able to start to make some positive changes for these patients so that they're able to kind of get back to just their normal life and not have to think about these awful issues.
Yeah. And I mean, it is really personalized to everybody's needs. You're really evaluating getting to know the patient, not just as a patient, but as a person, right? Like how personalized is the care that you're giving?
Yeah. So, I mean, we go through kind of our whole evaluation of what kind of symptoms they have, and we test, strength and motion and see what could be limiting them. And I ask a million very personal questions
Yeah.
to try to really understand what kind of triggers or issues might be contributing to their symptoms so that we can make those changes. So every patient's care is very specific to, what's going on in their life and, what changes they're willing to make or
Mhm.
that kind of thing.
And it's not just happening in the treatment or at the hospital or one of the outpatient locations. You give people home exercises, things to do at home to help continue their recovery.
Yeah. So, I mean, the ultimate goal is to be able to get them to be able to manage the symptoms on their own and to continue to manage them for the rest of their life.
Mhm.
So, giving them exercises to kind of strengthen the areas that they may have some weaknesses in that tend to resurface at some point. But also making sure that they have strategies to kind of modify some of the triggers or activities that might be contributing to their issues.
And so, where are you located at, and where are other places that someone could get pelvic floor therapy?
Yeah, so I am in Grand Rapids at our downtown location. We have a couple offsite locations as well. Um, I believe we're currently in Holland and at the Y. And then we have another location up north. But that's where, yeah, we have all sorts of areas.
And if someone was needing to get some therapy and work with you, how would they go about starting that process?
Yeah, so the best approach would probably be to talk with either their primary care physician or their gynecologist and to be able to get a referral. And then from that point, the referral would be sent to our referral and scheduling team, and they would be able to get scheduled for an evaluation.
And it sounds like in talking with you and preparing for this interview, you really enjoy your work and working with the patients. What keeps you coming to work every day?
Yeah, I love what I do. I mean, because these symptoms are so kind of hush hush and embarrassing, I think that it makes it all the more rewarding when I'm able to make a change for a patient and
Mhm.
give them, more confidence or more freedom to just live their life. And I love the team that we work with. And, we've got a lot of good support staff as well.
Mhm. Awesome. Well, Katie, thank you so much for chatting with us today and the video conversation about this pelvic floor therapy and the work that you're
Yeah,
doing with patients. I really appreciate you and all that you're doing to help.
of course. Thanks for having me.
This has been another video conversation here at Mary Free Bed Rehabilitation, educating and helping patients and sharing some of the work from our staff. If you have any more questions or things you want to learn about Mary Free Bed, go to maryfreebed.com and you can find all the information there. Thanks for watching.